All right, so first we're going to talk about glaucoma. So what actually is glaucoma? Glaucoma is a set of eye diseases that is caused by increased intraocular pressure, which damages the optic nerve. I'm sorry. So the optic nerve then transmits your visual surroundings. So basically, your optic nerve, everything that we see, right? It then transmits it to the brain so we can actually process what it is, right? So if this nerve becomes damaged, it results in vision loss and eventually lead to blindness. And this can be permanent. So early detection is vital with glaucoma, which can be done with an eye exam to monitor your intraocular pressure. So what is normal intraocular pressure? 10 to 21 mmHgs would be a normal intraocular pressure. So when talking about glaucoma, we have two key players, and that is your intraocular pressure. So basically, that is just the pressure within your eye, right? And the fluid that is in that pressure is called your aqueous humor. Okay, so we talked about the normal intraocular pressure, right, being 10 to 21, right? So the aqueous humor, it is the fluid within the eye that it has many roles, but it maintains your intraocular pressure. All right, does that make sense? So you need to know your intraocular pressure and your aqueous humor. Those are the two biggest things in your glaucoma. So what are some things that put people at risk for glaucoma? So we're going to remember, save your eyesight. So older adults, right, 60 or older, especially who have a family history of it, African American patients, Hispanic, Asian community, patients who have vascular problems such as diabetes and hypertension, right? And we've been talking all term long about how high blood pressure and how diabetes can lead to other issues in the body. So you want to teach your patients about controlling their diabetes and controlling their blood pressure so it won't lead to glaucoma, right? But those are risk factors. And also is a risk factor is elevated intraocular pressure puts them at risk for glaucoma. All right, so let's talk about open angle glaucoma. So in open angle glaucoma, the drainage angle is open. So let's find our drainage angle. And the drainage angle is right there, right? So the drainage angle is between the cornea and the iris. So basically, let me get my highlighter. This area is open, right? This area is open. All right, so like it should be, right? All right, but the meshwork is clogged. So what is the job of our transbuccular meshwork? We said that is like a strainer, like a drainage system, right? So if that is clogged, then we start to have what? A backup of pressure. So why does it become clogged? As we get older, the meshwork doesn't work as well to drain your aqueous humor, and it becomes thick and less permeable. Therefore, your aqueous humor does not drain out, but it stays in the eye and causes increased intraocular pressure. This pressure will compress the optic nerve, and over the time, this will cause vision loss. So we then go back to, if our optic nerve is being compressed, what did we say the job of the optic nerve was? The job of the optic nerve was to take whatever we see, right, and then transport it to our brain, right? So this is what is happening in open angle, that nothing is wrong with the fluid getting to the drainage system, but the meshwork is clogged, and that clogging is basically allowing the backup of fluid, which is causing the backup of increased intraocular pressure. I hope that makes sense. But just know that the problem is in your transbuccular meshwork. That is the problem, because it is being clogged. Okay? All right. So let's talk about open angle glaucoma signs and symptoms. So this is referred to as the thief of sight. Why? Because it is usually asymptomatic in your early stages. It happens gradually over time. And when the patient start to notice signs and symptoms, it is far already gone, right? This patient won't complain of any pain, increased intraocular pressure. The patient needs to have various readings done at different times. And that patient also can have loss of peripheral vision, which is your side vision, right? So, which is not really noticeable to the patient until they develop tunnel vision. And what is tunnel vision? Meaning nothing on the side matters, right? All we can see is tunnel vision. All they can see is just straight. They can't see any peripheral. So those are your signs and symptoms of open angle. All right, so with glaucoma, the closed angle, right? So the drainage angle becomes narrow. So before, the drainage angle was open like it should be, right? Therefore, in closed angle glaucoma, the aqueous humor cannot drain into the transbuccular meshwork, which is functioning and not clogged. So now the rows have reversed. Now with closed, they're saying, I can't even get the fluid there because it's so narrow. Now your meshwork, your drainage system is actually working, but the angle is so narrow that it can't get through. And this right here is very rare, but if it does happen, it needs emergency treatment before that patient loses their vision. So this one is very very big, that you need to know, even though it doesn't happen as often, but if it happens, this is a serious matter. So this slide just talks about how glaucoma can be diagnosed for both open and closed angle glaucoma. All right, so what are some treatments of glaucoma? So the biggest thing with glaucoma is we want to prevent further optic nerve damage, right? We want to maintain IOP within the range, unlikely to cause damage. And here are a list of your pharmacological therapies that can be used with glaucoma. They can have laser procedures or surgeries may be required, and we'll talk about that on the next slide. But considerations: focus on maintaining a therapeutic regimen for lifelong control. So tell your patient, hey, you are going to need to follow these medications for the rest of your life. You want to give them education on the medications regarding the use of it and the effects of the medications. And you just want to make sure that your patient knows about the medications that can be used for glaucoma.